So now this is a schematic of the brain on the top and the spinal cord on the bottom. So when you think about it, if you're hanging a picture on the wall and you hit your thumb with a hammer, the pain signal has to get from there to there. Okay, that's traveling up the nervous system. We call that the ascending pathway. It's ascending up to the brain. But it's more complicated than that. Because if you, A and delta fibers on the bottom, those are small fibers carrying the pain, goes into the spinal cord where I showed you the picture of a minute ago, synapses onto the second nerve, ascends up to the brain. If that was the whole story, treating anybody who has chronic pain would be very easy. Okay, you just need a tiny pair of scissors and a neurosurgeon on one end. Right? And that would solve the problem, but unfortunately it doesn't quite work that way. The neurosurgeons certainly tried. In the 60s and even into the 70s, this effort was tried, but we kept on discovering that the pain would reroute, it would start returning, and sometimes you had new problems as a result. So we know the system is much more complicated. In one way, it is what we call plastic, meaning it's changeable. The brain learns to reroute things. In addition, the complexity comes in that it's not only an ascending pathway. Your brain is sending signals down to the spinal cord and affecting that synapse down there. So the first way it can do that is a desirable way in many situations. It can shut off pain. If you imagine somebody, you know, hot into a basketball game and they jam their thumb and dislocate their thumb and they don't even know it. You know, they go up for the three-point shot, they make it, there's a break in the play, they sit down on the bench, they look down at the hands, see the crooked thumb, and now it starts to hurt. Okay? So what happened there? The brain was sending signals down to the spinal cord saying, we got something more important to do right now, this three-point shot. Okay? And so it shut off the pain signal at the spinal cord level. Of how we go about trying to treat pain. So we have the ascending pathways. That's on the left side of this slide. Right? They're the ones carrying the pain up to the brain. And I mentioned to you that there are small fibers that carry pain and big fibers that carry non-pain. So the small fibers that carry pain, we would love to turn those down or off. And we can do that to some degree with medications, anti-inflammatories, opioids, sometimes nerve blocks, sometimes destroying a nerve, although we don't do that very often. The big fibers that carry other signals that aren't pain, we would love to turn those up. Why? Because are you guys familiar with the term in the computer world and the communications world of bandwidth? Right? There's limited bandwidth, limited amount of room for information. The signals crowd out all available space. You won't feel the pain. So you hit your thumb with a hammer, and what's the first thing you do? Ouch, you shake it, you rub it, you lick it, anything to get those big fibers going. Right? You get the big fibers going and you don't feel the pain so much. It's a universal response. Okay? You watch your dog when it gets hurt. What's your dog do? Yeah. Okay. So it's activating the large fibers. So that's our first bit of strategy. Turn down the pain fibers and turn up the non-pain fibers. How do we turn up non-pain fibers? Rubbing, touching, electrical stimulation. Exercise is a fantastic way to do it. This is perhaps the most important. Pain and suffering, the circles on the right side, overlap, but they're not the same thing. How much suffering pain causes is driven by all kinds of things. And some of those I listed in the box on the left side. Okay? And those are driven by pain. Right? Patients in pain will become depressed and lonely, inactive, fear, have difficulty sleeping. Those in turn will cause more overlap of pain and suffering to the degree that the patient will actually feel more pain. So a good pain center can't just treat the pain. They got to treat all these other things too. This is just saying that when we do that, we get good results, and there's data to show it. And this, of course, is how patients come out when we do that, right? When we treat with physical therapy, psychological therapy, medical therapies, when we do the whole